Hi, my name is Heather Kemp, and this is my persuasive speech, and this is my audience. Hospice care was founded in 1948 by a doctor named Cicely Saunders. She centered her care around the terminally ill and actively dying patients. Then, in 1967, she opened the first modern hospice in London, England. The term hospice literally comes from the term hospitality. Hospice care aims to improve the quality of life and provide relief from symptoms that are associated with the dying process. Many symptoms of the dying process and associated with the disease can have a great impact on the quality of life during death. Terminal patients now have more choices than they ever have in how, where, and by what means they want to die. The three most important techniques to provide successful hospice care are good skin care, relief from breathlessness, and effective pain management. First, nutrition plays an important role in successful hospice care by maintaining good skin care for the hospice patient. Why, you ask, does nutrition have anything to do with skin? Here's why. Dehydration and lack of adequate amounts of protein lead to skin breakdown. According to Annual Editions Nursing, the goal for nutritional support is the same for hospice care, which includes improving the quality of life and relieve discomfort. Another way to provide good skin care is wound prevention and management. In an article titled Wound Care at the End of Life, some contributing factors that increases a patient's risk for wounds and pressure ulcers include malnutrition, weak or poor immune systems, and physical limitations that are always directly correlated with the patient's disease. Wound care management goals include keeping the wound clean and stable while maintaining patient comfort and a high quality of life. The next symptom must be treated immediately for successful hospice care is the treatment of breathlessness. This is a very frightening symptom for dying patients. In the book titled Palliative Care and End-of-Life Care, breathlessness is defined as an unpleasant awareness of difficulty in breathing by the patient. Symptoms that often accompany breathlessness are panic, anxiety, and tightness in the chest. Again, the goal in treating relief from this scary symptom while maintaining the highest quality of life, according to an article called Oxygen for End-of-Life Lung Cancer Care, treatments for breathlessness may include oxygen therapy and the use of opiate medication. One study found that 70% of doctors are willing to prescribe oxygen for their actively dying patients, which also makes family members feel more at ease. Oxygen and opiate use must be considered when treating a hospice patient to maintain the high quality of life and relief from this very uncomfortable symptom. Finally, the most important aspect in successful hospice care is effective pain management. Pain is often directly correlated with the patient's disease. Therefore, not treating the pain would have an adverse effect on the patient. Pain is a feeling that every person has experienced in their lifetime and can be described as physical suffering. In Annual Editions Nursing, pain affects the patient in numerous ways such as emotionally, psychologically, physically, and socially. Pain may also lead into more symptoms if left untreated, such as depression, anxiety, and decreased independence. Pain can lead to such adverse effects, so pain management and treatment is crucial in hospice care as to maintain the highest quality of life for the dying patient. The patient should be pain-free or as close to pain-free as possible. Pain treatments may include, but are not limited to, non-pharmaceutical approaches like a TENS unit, music, massage, and Chinese herbs. According to Palliative Care and End-of-Life Care. Pharmaceutical options include medications as mild as over-the-counter anti-inflammatories or something as strong as Vicodin, morphine, and oxycodone. There are many ways to treat pain, so if the first one is unsuccessful, something else may be prescribed until the patient receives relief from the pain. In conclusion, the three most important techniques to provide successful hospice care are good skin care, relief from breathlessness, and effective pain management. Nutrition plays a role in maintaining good skin care. Wound prevention and management are also vitally important in preventing costly and painful wounds for the dying patient. Breathlessness is often very scary for the patient and must be treated immediately to maintain the highest quality of life. Pain is the worst of all the symptoms associated with the dying process and must also be treated immediately. The most common method of treating pain in the hospice setting is by the use of pain medications. There are many medications that can be tried until the patient receives relief. To achieve a good death, the patient must have relief from these three symptoms while maintaining the highest quality of life during death.